News now, when they graduate in 3 years' time, a group of medical students at UBC Okanagan will be the first generation of doctors to be trained here in the Valley. But before they start practicing professionally, these would-be physicians need practice and training. And as Eric Zito reports, you can help.
Yeah, sometimes it's hard to feel, it's hard to repeat it. So you gotta be careful. I just got a very large heart.
They're the next generation of Canadian doctors, and they're the first class to get their training in the Okanagan.
Maybe just start a little bit lower. You don't have to actually push directly on the limit. Yeah.
For the past 3 months, 32 students from the program have been working with volunteers on a weekly basis. Today's focus is cardiovascular. Later on, it's respiratory. Hands-on training crucial to becoming real-world doctors.
I'll start out that early. You learn all this stuff in books and in lecture, and then you get to come in and you actually see why we're doing it, I guess. This is the reason why we're learning all this stuff and going through the books and memorizing everything. So it ties everything together, and it's really nice to get to interact with people.
This is where they actually learn to be a physician, in my mind. You can sit in a lecture hall and you can listen to information, and you go to the library and study stuff and look at stuff online. But it's not until you're actually interacting with patients that you're really learning what it's like to be a physician.
Experts say this hands-on training really develops a student's sense of how to interact with patients, what to do and what not to do. But officials say it wouldn't be possible without the volunteers, as each patient has a unique personality and medical history. While officials say these sessions shouldn't be a replacement for a regular doctor visit, it does go a long way towards shaping the doctors of tomorrow.
They really are one of the most important things about the program, because without the volunteer patients here, we would be relying primarily on simulated patients or just kind of self-exams, which is just not the same.
This medical program is unique in that it's a smaller group of students. During the first term, these students learned in Vancouver before being transferred to the Okanagan. Not only has this provided them with a more intimate learning environment, there's a belief that this could change perceptions about working in smaller communities, which often face chronic doctor shortages.
There's a big correlation between where you train and where you end up practicing at all levels. So, by having students train here, and hopefully at some point down the road, they'll be able to do their residencies in smaller centers as well. I think we're doing a lot for recruitment and retention of future physicians in this area.
Students like Kasha don't know what the future holds, but practicing in a rural community is something she would consider.
In a rural community, you are, maybe one of 2 doctors, or instead of, one of several hundred doctors, and so the reliance or the need for you to be on your game is a lot greater.
Is that something that appeals to you?
I think it does, but whether or not, when push comes to shove, if I actually feel like I can do that sort of thing, remains to be seen.
The Okanagan's first crop of new doctors will graduate in 2015. In Kelowna, Eric Zito, CHBC News.
Officials say they're always looking for volunteers. If you're interested, you can contact UBC Okanagan. Well, some